Kentucky Senator Republican Rand Paul is also a physician. He's been one of Obamacare's leading detractors, but now he may actually want to keep the law around for a while. He has a plan. Senator Paul joins us tonight from Washington. Senator, thanks for being here. What about this repeal, replace at the same time? Explain how this works.
Well, actually, I don't want to delay the repeal. I'm all for the repeal as soon as we can get to it, but we should vote on replacement the same day. And I'm putting together a bill that'll be out this week that will be a consensus replacement bill. There are many bills, probably 50 different Republican bills. Some of them have been out 2 and 3 decades for the replacement part. What we want to do in the replacement is legalize the ability to buy inexpensive insurance. Get rid of the Obamacare mandates. Let any insurance product be sold, particularly inexpensive insurance products. That's number one. Let people save tax-free, give them tax credits for health savings accounts so they can buy insurance. And then the third thing we want to do is let individuals come together as part of groups or associations so they can buy their insurance as part of a big pool to have leverage to get lower prices, and also so they don't get affected by adverse things like pre-existing conditions.
All right, I want to put up the bullet points of this plan. Basically, reducing costs, expanding access, expanding choices, leveling the playing field is how you describe it here. But is there consensus on this, and does it include pre-existing conditions and keeping kids on until 26? The good things about, that people talk about Obamacare.
I think there is Republican consensus on replacement. The ideas that we've taken for the replacement bill come from other Republicans' bills. There's very little that I've put together in my replacement bill that is an original idea, that's not an idea already been put out by other Republicans. In fact, most of these ideas, Congressman Tom Price, who is designated to be in Trump's cabinet, has been in favor of. He's another physician in Congress who's put together a lot of replacement ideas over the years. And so basically, we've put together the most popular, and I think there is a consensus. I think it'll pass overwhelmingly in the House. The question in the Senate is, will Democrats be willing to work with us to replace Obamacare?
But what about those two substantive questions about the pre-existing conditions and up to 26?
Yeah, on the 26, I think that's part of the underlying law. So unless it is repealed in the underlying law, it would still be part of the law. I think it's going to still be part of the law that's not repealed. On pre-existing conditions, you can't let people wait till they're sick to buy insurance, because if you do, it bankrupts the whole system. Young people won't buy into it. They say, I'm going to wait till I get sick. So what we do to fix the pre-existing condition clause is we try to get people into what are called association plans. These are group plans. So if you're a mom and pop and you have a pest control business, instead of you buying insurance by yourself, where you might be affected by pre-existing conditions, let you buy your insurance as part of a big group, and then you're not affected by pre-existing conditions. My goal is that there's about 11 million people in the individual insurance market. I want every one of them to be able to buy insurance as part of a group in an association market. So the goal would be that the people most affected by pre-existing conditions, small businesses and individuals, they would no longer have to have that problem, because they would be put into big groups and they would be able to buy insurance as a part of a large insurance pool.